Hello again, good morning. I do these lives every day this week, and on Instagram you can go in and you can kind of like select your face that you want to come on to be like the cover of the video, and on Facebook it seems to allocate a picture which is generally like me doing some kind of crazy mouth shape, so that's probably the one it will stick on for me for today. Things you don't want to see about yourself first thing in the morning. Hello, I hope you're all well. I've been doing a live every day this week to celebrate our summer sale event. Not sure what to do this summer, why don't you spend it learning all about scars? You could make such a difference to individuals that you see with historic or with new trauma or surgeries, scarring, and you could really get thinking about all of the different approaches that you could take to help support their recovery, from little nuggets of simple information about scar care products to really getting a deeper understanding to the fascial system and how trauma injury at one point in your life can actually lead on to other complications later on. So it's a fantastic course, and it's got 50% off up until Friday next week, the 5th, and the discount code is LIVE2024, and that's Understanding Scars Online Advanced Theory. But you're getting lots of free bits of education as part of this week's live educational lives. Live educational lives, yes. And on Monday I was talking about sort of documentation, things you might want to think about when you're finding out about your client, when you're what to do with your note taking, kind of describing the scar in your notes, but also thinking about what you might ask them to document. You know, how documentation can be used to help track progress for the client as well. Then on Tuesday I was talking about get moving, and that was just so important to really get across the idea that scar tissue continues to stiffen over time and can continue to proliferate as well. I think a lot of our clients will just assume, well, I had the injury or the surgery and then that's it, and what they don't realise is, particularly when there's ongoing inflammation, which ties into what I'm talking about today with the ongoing oedema that you can have in some individuals, you can actually have a continued production of scar tissue. So over time that situation is actually getting worse, not better. So certainly something that's really important to be aware of. Then Wednesday, yesterday, a hot day, wasn't it? And I was talking about hydration, but not just about fluid intake, thinking about what your skin does in terms of being a barrier and how important it is to kind of lock in the fluid, and how the body doesn't like that fluid escaping, so you get messages such as pain and itching and ongoing messages to produce more scar tissue. So if we tone down those messages, we get better scarring results, and the skin and scar is happier, which means you get less pain and itching. Today I'm talking about keep it up. So this idea of kind of like what happens with somebody who's got persisting edema, still got fluid build up around their scar, even can happen decades later. Common ones that might come to mind might be individuals who've got like lower limb traumas, and they say, oh, at the end of the day, yes, my ankle swells after, you know, so long on my feet, or if it's really hot, then they notice that they're getting not very good fluid return below their injury. And then tomorrow I'm going to be talking about mixing it up, how actually you shouldn't just have a singular approach to treating scar tissue. It's much more effective to have a whole range of ways that you can stimulate that tissue to get the results that you want. So if you are doing a fantastic job already with a singular modality where you're kind of using one approach, think about how much more that you could get if you started varying it up, particularly through a longer treatment program, because you may find that you're plateauing and you need that different stimulus and input to move them on even further. So let's get started then. And I think I've got a client that comes straight to mind, which made me want to put on this video today and talk about this impact of kind of persisting fluid buildup. It's a lady who came to me after total knee replacement, and she'd really put off having her knee surgery. She's still under 60, and you know, in terms of general health for the rest of her body, everything's really good, and she wants to lead a sort of normal and active life, as do most of our clients after surgery. And what's happened with her is she developed a lot of scar tissue. She went in for manipulation under anaesthetic to try and get the knee going to more range of movement in her knee, so they numb the area and forcibly try and sort of tear the scar tissue really, to try and get the knee joint moving better. That was unsuccessful. She then went in for, the surgeon did a keyhole surgery to remove some of the scar tissue that was forming around the knee, and she was still going through lots of physio and really feeling stuck when she reached out and found me and said, could you help me with my knee? The medical sort of people that she'd seen had basically said there's nothing further that they can do. And one of the first things that was really apparent was that there was pitting edema around the knee joint. So pitting edema, if you do a little push test, it should be that the skin bounces up like we've got here, a nice good tissue response. With pitting edema, you'll notice that it stays depressed for longer, so really showing that you've not got very healthy tissue there. And if you've got that, you need to really think that this person has got quite compromised fluid movement through that tissue, and we really need to think about supporting the lymphatic system and helping to reduce fluid buildup in that area. So by that, what you should think about is what different modalities you can use. So if you're predominantly working with exercise, maybe as a physio doing all of the recovery, I would suggest a manual lymphatic drainage, or somebody trained in ideally scar tissue and manual lymphatic drainage would be the best course of action for that person. But otherwise, what else could you think about? Compression garments can be really, really fantastic. So they actually can help support the body. It seems strange, doesn't it, to put a bit of pressure on, but it helps actually with that lymphatic flow by increasing the pressure around the area. So I've got a few examples here. So after abdominal surgery, you can get these kind of like wrap garments that you put around, which can help provide some compression. And there are also compression garments after breast surgery. So this one from Prairie Wear is a really nice compression bra. So what you should see in a compression bra would be a really nice big elastic to go under the breast. A small underwire is really going to cut in, so you may then see a kind of pooling fluid build up above that. You want nice big shoulder straps. This one has got adjustable shoulder straps, so it's actually got different ways that you can put it on there, and it provides medical compression, so a nice stretchy bra there. Really great quality. I love those Prairie Wear bras. And another one example here, this is a lipoelastic bra. They purposely put the labels on the outside so it doesn't cause extra indentations for people post-operation, and this one is specifically developed for lipofilling. It's got lots of space in there for not to put too much compression on the area where the fat's been put in. Again, lovely big elastic band around the bottom is much more suitable to help put an even spread of pressure rather than something that cuts in and actually cuts off the fluid flow. But you can get compression wear for all shapes and sizes. This from Job Skin, they specialise in a range of fun designs for children who've had injuries. So this little hand sleeve, potentially after burn injury, for example, for a young child as well. But so you can get handmade garments for individuals. If somebody's had an amputation, if somebody's got a stump, they'll often be straight into compression to stop fluid build up in that area. So certainly something I think is highly effective. There's lots of products that you can look at if you want to think about compression, but I would suggest it needs to be somebody who's skilled in understanding measuring, who should be measuring and prescribing compression garments. Certainly if you get a badly fitted garment or the wrong garment, you could actually make the situation worse and cause more problems for the individual that you're working with. So see somebody who says that they've completed training, which is normally comes up with manual lymphatic drainage specialists, so MLD UK would be a good place to start. It's a website that's got the trained manual lymphatic drainage professionals around the UK. So as well as compression garments, what about with the kind of like with manual movements, what can we do? So certainly the tissue is stagnant, the tissue is stuck. So with the individual I was discussing, we haven't got her in compression garments. I have been doing some kinesiotaping with her to do some drainage, and also to provide a little bit of extra support around the edge of the patella, which was an area which was providing a lot of pain. So actually changing the stimulus, putting a bit more tension around those areas has really helped her in between appointments, and during the appointments we get a massive reduction in the fluid with the scar massage techniques that I'm using with her and the devices that I'm using in clinic. So just with massaging around the area and thinking about that bigger picture. If you've got somebody with a scar, we're very often drawn to the scar, but if we think about something like a knee replacement or a traumatic injury, you've got to think about the whole area, the three-dimensional area, what will be impacted above and below, and really take that bigger approach to treatment, so you're not being too specific on the scar. So certainly the restore approach will be to go above and below, make sure you really get everything moving, think about coming in behind the knee, up through the hamstrings, think about the leg, the hip, and kind of connecting all of that up rather than just be focused on the scar itself. And that's going to get you better results. And then if you can, there are some amazing devices out there that can really help not only soften the scar tissue, which itself may be causing a bit of a dam with that fluid build-up, but can also really help with the fluid movement itself. So either thinking about the deep oscillation device, which is a great device from Physiopod in the UK. You can either, in fact, clients can buy this to use themselves, quite a premium product that clients can use themselves, but I have had clients who have bought them. I like the mode where you wear gloves, so I can still do my scar massage while having the added oscillation. It's you work with a current between you and the client, and the tissue lifts and drops really, really quickly. It feels like a buzzing, and it helps to soften and move tissue around the area, and something that a lot of clients really enjoy. They find it very soothing and calming, and it gives great results. Or I've just got the new LymphaTouch device. This is the LymphaTouch Pro, which is a negative pressure targeted vacuum massage machine. So basically, therapist holds this little cup. I like the pulse setting, so it goes on a little pulse up and down. And there are all different cup sizes. You can change the pressure, and that in itself is lifting and creating space through that interstitial, superficial fascial layer, helping with the drainage, helping to promote movement, and also stretching the scar tissue very specifically in the direction and the angles that you want to do it. And I think that that's something that I use a lot, but in the way that I teach, it's really important that I meet a range of budgets, and not everyone has got the capacity to afford that kind of big device. So I also talk about how you can use these little silicone facial cups. I get my clients to buy silicone facial cups in a lot of occasions. So it's not only something that we can use in clinic, but it's something that we can prescribe for clients to self-treat with. And it's so effective. Just stick the cups on, you can get a bit of lift, you can move the tissue, you can loosen up the scar, and it's quite, the way I like these little silicone facial cups, they often come in bigger sizes, but I wouldn't recommend that because the client could start traumatising the tissue, which could lead to more injury and so on. A lot of people love the sensation got by this little cup, which actually targets more superficial skin. So although it might not feel like a strong lift, it's very specific, the area it's lifting up as well, and is great in early healing, just to start lifting up that superficial tissue and trying to prevent adhesions. And they're available, silicone facial cups, on Amazon and eBay. All of the things that I've mentioned are something that if you approach a therapist who's trained in Restore Scar Therapy, they'll be able to help you. So if you're watching this video because you've had a surgery or an injury, you can go to our new directory at restorescartherapy.com, where we've got a global map of therapists, and you can find somebody to help you. But that's me for today. If you want to learn more about scars, don't forget, sign up to Understanding Scars at half price, £174.50, right up until Friday the 5th of July, and the code is LIVE2024. And if you have missed some of the other things I'm talking about, I talked on Monday about documentation and client notes, on Tuesday about scar tissue stiffness, adhesions, how that really actually can have an ongoing effect. Yesterday, Wednesday, I talked about what we can do with scar care products to help look after the skin. So have a drink, hydration and scar tissue. And tomorrow I'm talking about a multi-dimensional approach to treatment and how that can bring the best results. I hope that was helpful. If you think this is useful, please share it into some of the therapy groups that you may be in. Tell a friend. Let's get more people thinking about scars, because it's going to really benefit people who've had a surgery or injury if more of us in the healthcare community can be aware of how these kind of techniques can help with scarring. Bye everyone.